Hello, everyone, and welcome back to the Heart Guardian podcast for Healthy Heart. I'm your host, Dr. Aman Kapoor, and welcome you back to this exciting episode. In our today's episode, we are exploring the fantastic and fascinating world of heart valves. These are tiny yet crucial parts of a heart that ensure the blood flows in the right direction and our body gets the oxygen it needs. To help us understand more about these heart valves, the way they work, and what happens when they don't, we have with us the eminent cardiologist Dr. Jagdish Hiramat with us, who's going to guide us about these heart valves in an engaging and simple manner for easy understanding of all of us. Welcome back, Hiramat sir. I would request you to guide our listeners about the basic functionings of heart valve. Why are they so important for our heart's health? So over to you, sir.
One of the important building blocks for the heart to function as it does are the valves of the heart. We know that the heart receives blood from the body which is impure or deoxygenated. It goes from the right upper compartment to the right lower compartment, the right ventricle, and from there it is pumped into the lungs for purification. Then it returns to the left upper compartment as a purified and oxygenated blood, and from the left atrium to the left ventricle and flows through the left ventricle to the aorta and the entire body. We know thus that the blood direction has to be one direction, that means unidirectional. Blood must flow out of the right atrium to right ventricle to the lungs to the left atrium to the left ventricle to the aorta. In order to manage this unidirectional flow, we have these heart valves. Between the right atrium and the right ventricle is the tricuspid valve. Right ventricle to the lungs is the pulmonary valve. From left atrium to left ventricle is the mitral valve. And from left ventricle to the aorta is the aortic valve. These valves are made of specialized tissues that are not hard and that are not weak also. So the substance that they are made of are unique for the valves itself. It has to be supple enough to open and close for millions of times and strong enough not to allow blood back into the other direction when they close, thus keeping the circulation unidirectional. The four heart valves function in an exceptionally sequential manner. When the tricuspid valve opens, the pulmonary valve is closed. The pulmonary valve opens, the tricuspid valve gets closed. And so it happens on the left side of mitral and the aortic valve as well. The innate electrical circuit and the intelligence provided to the valves is such that this sequence never ever changes. Think of the work done by the valves. With every heartbeat, all four heart valves open and close once, so it is at least 70 times a minute, into 16 1 hour, into 24 hours in a day, and into 365 in 1 year. So in a lifespan of 75 years, the calculator is inadequate to make out how many times the heart valves open and close. For any valve-like structure to keep on moving like this so many times, it has to be exceptionally durable material, and one keeps on marveling at nature's phenomenal design about mechanics of these valves and the way they function. When the heart valves are functioning normally, they are absolutely soundless. We never hear any opening or closing of the valve, despite the fact all four of them do it at least 70 times in a minute. But the heart valves can get affected by diseases, and that is where the valvular heart diseases come into picture. About 4% of the valves are defective from birth as nature's manufacturing defect, and they are known as congenital heart valve defects. 3 out of 100 valves are bicuspid aortic valves, so that instead of having 3 cusps or petals for the aortic valve, the person is born with only 2 cusps, and this is known as a bicuspid aortic valve. By the age of 40 to 50 years, these valves get diseased, hardened, and stop functioning normally. A disease which can affect the heart other side of the life is a degenerative disease. When the valves are old, get hard, get calcium deposition, and function abnormally. Rheumatic heart valve disease is the commonest disease in India. It's a bacterial infection in the age group of 5 to 15. It licks the joint. That means there is a sign of arthritis or joint pain and swelling for a few days. It subsides totally, leaving the joint unaffected. But the substances related to the bacterium deposit on the valves, and over a period of many decades after this, develop into leaking valves or narrowed valves, and it is a large number of patients who suffer from this rheumatic heart valve disease. Infection can affect the heart valves, a disease called infective endocarditis. It is so deadly that practically it can destroy the heart valves. Lack of blood supply, called ischemia, can affect the heart valve. Congenital, degenerative, rheumatic, ischemic and infective are the 5 diseases which affect the valve, and there could be some rarer diseases we need not mention here. The mitral valve gets affected most commonly by the rheumatic valvular disease. Next in sequence is the aortic valve. The pulmonary and the tricuspid valve are on the right side and get affected less commonly. Let's take example of a mitral valve which is not closing well. It's called the mitral regurgitation, and the unidirectional flow is affected. Blood moves from the left ventricle to the aorta, but also into the left atrium through the leaking mitral valve. This kind of a regurgitation can occur for the aortic valve, tricuspid valve, and the pulmonary valve also. On the other side, the valves get tough, hardened through various diseases, especially rheumatic, and they don't open well. For example, a fully open mitral valve has an area of about 4 centimeters square in an adult, but it narrows down to 1.51. And then the emptying of the left atrium into the left ventricle is a problem. The left atrium gets bigger, collects blood clots, patient gets breathless, and unless the stenosis or the narrowing of the mitral valve is sorted out, the person will get worse and worse. The pulmonary valve, which is present between the right ventricle and the lungs, does get what is called as a pulmonary stenosis. Usually this is a defect by birth. Unless it is sorted out, the right ventricle will pump harder and harder into the narrowed valve, eventually get tired, gets enlarged and gets failure of the right ventricle. Thus every valve can get affected, more commonly the mitral and the aortic valve. And when the abnormality or abnormal function reaches a state where the heart cannot tolerate it anymore, there has to be mechanical treatment, that is replacement of these valves or opening of these valves by some mechanical treatments. Many of the patients who have stenotic and regurgitant lesions can be managed with medication to some extent where they are reasonably comfortable in their day-to-day routine and they are leading a reasonable life. The best diagnosis of a heart valve disease is done by echocardiography, which is actually sonography of the heart. The initial tests like ECG, X-ray will be done along with the physical examination, but the preciseness comes from echocardiography. It gives us the nature of affection, it gives us the extent of the disease, it gives us how much strain the valve is suffering, and whether there is an indication to replace the valves and treat it mechanically. So to generalize, if a person has disease of the valve, one of the commonest symptoms will be getting out of breath on activities. There could be palpitation due to irregular heartbeat, there could be difficulty in lying down due to suffocating feeling, and there could be persistent cough or bringing out blood from the sputum. Finally, of course, it leads to swelling of the legs, and really terminally valvular heart disease patient is bedridden, swelling of the face and feet, lack of oxygen, and then the time is really short. By this time, the output from the heart, which is normally about 5 liters per minute, has dropped down to 3 liters per minute or less. Once the transthoracic echocardiography, that means the probe is on the chest wall, tells us that yes, there is an indication for mechanical treatment, a transesophageal echocardiography is performed. Here, the ultrasound probe is passed through the mouth into the food pipe. It goes behind the heart, and there is no interference of the lungs then. You get beautiful pictures because of the transesophageal approach, and that is where we finally decide that the valve needs a mechanical treatment. In the initial stages, heart valve disease, the person is symptomatic only on exertion, can be given medication which will make the patient pass more urine, the retained water is passed off, and there is a significant relief of breathlessness and swelling of the feet. There is no medication, however, which can reverse the disease that has taken place in the valve. When the disease is mild or moderate, medication can pull on for a number of years before a surgery or a definitive treatment is taken on. For a stenotic pulmonary valve or a tricuspid valve or a mitral valve or aortic valve, a balloon procedure is performed which is not a surgery. The balloon is passed from the groin, and the balloon then opens up the artery to significant extent. The best results of the balloon valvuloplasty are on the mitral valve, but the other valves don't respond to balloon so favorably. For regurgitant or leaking valves, when the person is symptomatic, the heart is enlarged, the lungs pressure has gone up, one has to think of replacement of the valves with surgery. This is an open heart surgery and has been going on for last at least 4 to 5 decades. And the success rate of these surgical procedures is really high, more than 90%. The valves artificially used in these procedures and surgeries will be discussed at some point of a time later. Newer modalities of treatment have come up now. These are non-surgical methods called TAVR, transcutaneous aortic valve replacement, wherein a person is very old, cannot undergo the major open heart surgery, the anesthesia is risky. At this point, a new valve is inserted in place of the old one through the groin again. A leaking mitral valve is nowadays closed by what is known as a mitra clip, again not a surgery, and it is reserved only for extremely diseased patients. Finally comes a stage where patient has undergone some surgeries, the valve is destroyed, or the heart is too weak to undergo any surgery. That is the time when transplantation of the heart can take place to relieve the patient of his miseries. Thus, valvular heart disease is a definite entity which can be troublesome. It's a chronic disease and lingers on with the patient for a number of years. The patients have to learn to live with it even after performing surgical procedures, balloon valvuloplasties and TAVR. Some kind of medication, blood thinners will continue. Preventive penicillin injections for rheumatic heart disease, medical treatment for symptoms, mechanical treatment as discussed, are all in the armory of we doctors, and we continue to fight with the valvular heart disease to the best of our abilities. Nature poses problems on one side, and the medical fraternity tries to overcome them.
Thank you so much, sir, for explaining us such an important topic in such simple manners. My dear friend, take care of your heart, take care of your heart valves, and your heart will say thank you to you so that you can say thank you to your heart and your heart valves. And as always, remember to share this knowledge with everyone. This knowledge can help save someone's life. So, like it, follow it if you have not started following it, and share this to all the social media platforms you are on. And till the next episode, stay healthy, stay fit and fine. This is your friend and host, Dr. Aman Kapoor, signing over and out. Bye-bye.